Are you turning 65 or retiring in November, December, or January? Well, if so, you'll need to act relatively soon as your time frame to take action is actually relatively limited. Well, in this short video right here, I'm going to give you some pro tips to save you a bunch of time, a lot of frustration and confusion, and a pile of money. So if that sounds good to you, then stick with me. I'll do my very best to help you out in any way that I possibly can, completely for free, to provide as much value as I possibly can, and to help you through this time, because it can be very, very confusing, especially transitioning into retirement as well as turning 65. I totally get it. I just went through this with my parents last year. It was a very exciting time for them, but also a little bit confusing, like, what do we do now? Like, where do we go? Where do I get answers to our questions? What do we do? So I helped my parents with this, and again, I want to help you here in this time for you as well. Now, if you are turning 65, happy birthday. If you are retiring, congratulations. That can be very, very liberating and a very exciting time to finally escape the grips of employment and be like, finally, I get to enjoy my life. This is very exciting, right? Now, first off, I do want to give a couple quick shout outs to Scott Hoagland, Ken Johnson, Pamela Avery, and Michael Fernandez, all of which reached out to me recently, along with about 4,000 plus of you here in this community, because they called that phone number right there to get some free help with their Medicare plan. The names that I just rattled off right there, all of them reached out down below in the comment section because they got better plans, saving money, saving a bunch of time and frustration, as well as getting better coverages because they called, again, that phone number to get some free help with their Medicare plan. It's a team of advisors that have access to over 20,000 plans across the country, and they are working diligently to help people every single day on Medicare. Like I said, over 4,000 people here in this community alone have called that phone number to get that free help right there. More specifically, Ken Johnson, one of the names I just mentioned there, he said specifically he is saving $174 a month because he called, again, that phone number to get some help with his Medicare, and he's saving $174 a month. That's over $2,000 a year that he's saving from a free, simple review of his Medicare plan. Absolutely incredible, right? So anyway, if you're in that situation, make sure to do that. Seriously, 100% free. They will help you out. That's really good stuff. I mean, they're helping so many people here in this community. Really, really awesome to see that. Anyway, after you talk to them, leave me a comment down below. Use the word chapter within your comment. That's the keyword that I search for, by the way. And I'd love to feature you and give you a shout out in a future video. Okay, turning 65, retiring. Regardless of what the situation is, let me tell you the details here. And again, this pertains to those of you that are either retiring or turning 65 in the months of November, December, and January, okay? If that applies, or if you're turning 65 or retiring now for October, this is also vitally important. Your time is, time is of the essence, as they like to say, right? Anyway, let me point this out here. Okay, so as somebody that's turning 65, here's what's super important about this. Again, the same goes for retiring as well, but your time frame in which to enroll in Medicare is relatively limited, even though it feels like, I have all the time in the world. It feels that way. You have a 7-month window for those people turning 65, and if you're retiring, you have an 8-month window. 7 or 8 month, regardless how you look at it. It feels like a very long time, but I can tell you this much. It goes very, very fast. It goes very fast. Okay, but here's the deal. If you're turning 65, you have the 3 months before the month in which you turn 65. That's your initial enrollment time frame. 3 months before, the month of, and 3 months after you turn 65 to enroll in Medicare. Now, here's the thing I want to point out for you. A lot of people don't realize this, and I'm going to tell you my personal experience as well. I enrolled in Medicare many years ago. Because I'm 65? No, I'm not 65. I'm not 65, I'm telling you that much, okay? But I did roll in Medicare because receiving SSDI, Social Security Disability Insurance benefits, because I'm blind, can't see. So I get disability benefits, right? As a result of that, after 2 years of getting disability benefits, I'm also offered the opportunity to enroll in Medicare, okay? Medicare Part B. Now here's the deal. I didn't know this. I delayed enrolling in Medicare Part B for about 5 or 6 years, give or take a little. I don't even know how long it was. It was about 5 or 6 years. I didn't know this. There was a huge penalty, 10% penalty per year that I did not enroll. Guess who's still paying a penalty today for the rest of my life that I'm on Medicare? Yeah, this guy right here, me. I am. Why? I didn't know about the penalty. Had no idea. This was many years ago. I had no idea that there was a penalty. And I just waited. I'm young and I'm healthy. I don't need to go to the doctor. I don't need insurance. That was a bad move. I didn't know. I had no idea. Nobody told me. I had no idea. So if this can be valuable to you in any way, shape, or form right here, just recognize this. If you delay enrolling in Medicare, you will get a lifelong permanent penalty forever that you will pay. I can tell you this much. The penalty is not fun to pay, and it'll be there forever. Lifelong penalty, okay? So there you go. I mean, this video alone hopefully just saved you a ton of money right there just by knowing that little quick tip right there, okay? But anyway, you have this enrollment window. Please take advantage of it. I know that it feels like I have a lot of time, I'm good. You don't have a lot of time. It goes very quickly here, okay? But here's what I want to point out. This right here, I know I've talked about this a couple times. This phone number will save you a ton of time, frustration, confusion. They have access to over 20,000 plans across the country. They will look through the plans, find you the best plan at the best price with the best coverages and the best fit for you and your personal situation in your local area. Now, I want to give you a couple pro tips here. Number one, when you call them, bring your list of questions. They will answer them for you, okay? That's number one. Number two, bring your wish list. No one does this. Literally no one does this. Bring your wish list. Act like you're going to the grocery store shopping. What's on your list? I want to see this doctor and provider. I want to go to this clinic and this office. I want to have access to this hospital system or whatever it is, right? I want to be within this network. Oh, by the way, I want prescription coverage. I want dental coverage. I want hearing coverage. I want vision coverage. I want XYZ coverage. Doesn't matter. Tell them that. They will find that. They will be able to curate all the plans in your area to make sure that you're getting exactly what you want for your personal situation. Also, not only tell them all that I said there, but as well, tell them exactly what you want as far as, hey, I want my premium to be X dollars or less. I want my deductible to be X dollars or less, right? I want my co-pays to be X dollars or less. I want these additional benefits along with my plan. They can find you all of that. Again, nobody does this. Everybody just calls or everybody just goes and gets a plan and they're like, what's my best option? Like, what's a good one? What do you recommend? That's a bad one. Don't ask what people recommend. Just be like, hey, what is the best fit for me? Here is what I want. Here's what I need. What are my options? Like, what's the best fit that's out there? And they can narrow it down. Again, they will do all that. They have access, like I said, 20,000 plus plans across the country, and they can do all that for you, okay? So just write all your questions out, write your wish list out. When you call them, tell them everything. By the way, they're going to ask you a few quick questions. They need to know some basic information to understand what you need in your plan. But here's the deal. When you enroll in Medicare, okay, so let's just say that you are turning 65 in December, for example, okay? I'm just giving this as an example, but it could be November, could be January, whatever it happens to be. When you enroll, okay, your Medicare will start the month in which you turn 65. If you delay, then it'll start the beginning of the month, the following month, okay? So just be prepared. You don't want to go a month without insurance. You can. I wouldn't recommend it. If you needed some kind of medical attention or something like that, that'd be really bad. If you were not covered, it could be really expensive or really, really fast, right? Have you looked how much doctors are billing these days? It's very expensive, right? So you typically get those that paperwork that comes in that says something like, this is not a bill. If you ever looked at that, it's like a lot of money that they're billing for just very basic things. Anyway, so very important. So anyway, when you call them, very important, when you call them, they will help you with all of this, and they will find you the plans that are right for you and your situation, okay? So they can get all that set up for you, get everything together, everything organized, everything for you, so that when you are turning 65, you have that coverage immediately, and there's no lapse in your coverage. The same goes with retirement. If you're retiring, same situation goes, okay? If you're retiring, you're probably losing your coverage from your health, from your employer, right? Your healthcare coverages from your employer. If that's the case, you also have your 8-month special enrollment period where you open it up and you get 8 months to basically get into a plan. Same situation applies. If you're enrolling in Medicare because you're 65 or over and you've lost your healthcare coverages because of your employer and your retirement, very important. They will help you with all that. go ahead and do that, okay? So anyway, it's free. By the way, it's 100% for free. I've got nothing to sell you here. I'm helping you out with this simply because, like I said, I went through this process last year with my parents. They turned 65. It was an absolute nightmare. We hacked it out ourselves. Bad idea. Why? Because we didn't know that they exist. We didn't know at the time. Last year, had no idea that they existed. So here we are, my parents and I, we're hacking this out, trying to find them a plan, enrolling them in Medicare, and getting them a supplement and things like that. And it's like, I don't know. Like, what's the best plan for them? I don't know. I have no idea what my parents need, right? I mean, I have no idea what they need medically. I mean, I know my parents, but I don't know what they need medically. That's not really my business, right? So here we are trying to hack this out. Anyway, because of that, we cultivated this partnership to help those of you here in this community completely for free with your Medicare needs, things like that, okay? Anyway, take advantage of that, please. It's free. Take advantage of that. Please do not try to hack this out. You can, if you want to, by all means, go for it. Hack this out yourself. It's totally fine. All I'm saying is that, like I mentioned at the beginning of the video, if you want to save time, money, frustration, confusion, they'll do all that for you. Okay? It's a really good thing. You jump on the phone call. They're going to ask you a series of questions just to better understand the situation. By the way, you will also be present with your wish list and your needs and whatever it is that you want, right? So you'll, in your list of questions, you'll be armed with all that. And again, you'll just spend a little bit of time on the phone, and they'll help you with all that completely for free. All right, anyway. So I want to share this with you. Just remember, your Medicare plan will start the month in which you turn 65, provided you enroll before your 65th birth month, okay? Very important there, but if you miss that, it'll start the first month of the following month, provided you enroll in time, okay? If your birthday is in October, you need to act immediately. If your birthday is in November, you also need to act immediately to get this all set up, because so it can start the 1st of November, okay? December, same situation. But anyway, I hope this helps you. Let me know what I can do for you. I'm here for you in any way that I possibly can be to help you out, to give you pro tips, to understand it, and just to help you navigate all this. I get it. It's very, very confusing. Totally understand that. I want to do what I can to provide value to you, help you through this, answer your questions. Leave a comment down below. Let me know what I can do to help you through this, to better serve you. Let me know, okay? By the way, I'm talking about Social Security and fixed income benefits and everything like this every single day in these short videos. Let me know what else I can do. Thousands of videos, about 6,000 videos here on the channel. Check those out. Otherwise, until next time, enjoy. Leave a comment down below. Let me know. Give them a call. They will help you out 100% for free. Let me know how it goes. Leave a comment down below, and I will feature you in an upcoming video, just like the people I gave shoutouts to earlier. Seriously, very important time. You need to act soon, and just let me know what else I can do for you. Otherwise, enjoy. Please subscribe, 100% free. Big subscribe button down below. Please share the video. Big share button down below. Check out the other 6,000 videos here on the channel in the video library. Otherwise, share this video with anybody that you know that's turning 65 or retiring, so they can also get this valuable help. And until then, enjoy. Have a good one.